right, welcome everyone to the October 25th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwizdowski-Govin, Chair of the Grafton Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn here.
Austin Magnan.
Magnan present.
Bill Muller.
Bill Muller here.
And Jennifer Maynard, I don't see yet. Staff and anticipated speaks on the agenda. When I call your name, please respond in the affirmative. I know Nancy is off today. Colleen Boland from the Alliance.
Hi, everybody here.
Hey, Colleen. That was it for who we were expecting, and I don't see anyone else on. I'd like to open the meeting. Can I get a motion to open the meeting?
Yep. This is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
Austin Magnan. I will second that motion to open the meeting.
All right, and then all in favor?
Dan Finn, aye.
Magnan, aye.
Bill Muller, aye.
Karen Gwizdowski-Govin, aye. All right, good evening. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency regarding COVID-19. This act includes an extension until April 1st of 2022 of the remote meeting provisions of Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the Act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because, as you're well aware, anything that you broadcast may be captured by the recording of this meeting. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Prior to us turning to the first item on the agenda, permit me to cover some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. If there are any speakers for a topic on the agenda, I'll introduce them. After they conclude their remarks, I'll go down the list to see if any board members have any questions, comments, or any types of motions. Furthermore, please remember to mute your phone or computer when you're not speaking and then to speak clearly and in a way that helps generate accurate minutes if you are speaking about a topic. For any response, please wait until I, the chair, yields the floor to you and state your name before speaking. That is it. Oh, sorry. And if there are any votes taken during this meeting, they will be conducted by roll call vote. All right. Hi, Jen. All righty. So with that, we can turn to the first topic on the agenda, which is the COVID-19 mitigation efforts. As a reminder for the board members and Colleen, this is a continuation of our previous discussions from the September meeting and the earlier October meeting around any potential mandates or orders regarding COVID mitigation efforts such as masking while indoors. As a reminder, the Alliance had previously forwarded, or Nancy, I think at one point had forwarded when all three of them were done by Shrewsbury and Worcester, she had forwarded over to the board members the three different mandates to be potentially reviewed. Just briefly for a reminder's sake, one of them was mandatory reporting of positive COVID cases by businesses. Just briefly, that's the mandate that the governor had been rescinded when the governor had lifted various mandates and orders. So at this point, if we wanted to put something in place for case investigation that was coming out of a business in town regarding contact tracing, proper cleaning, et cetera, because it's not at a state level anymore. The second one was around mandatory masking for all students and employees for all types of schools, not just the ones covered already by the DESE side of things, such as our public school system. So this would also cover parochial, charter, or any type of private schools. And then the third one on the table was to require masks in all indoor spaces open to public, such as businesses, retail, restaurants, bars, places of like churches, fitness establishments. Coming out of our last meeting in early October, Dan graciously offered to do some research around like trending, what other towns are doing. I know we had questions as a group if we were to try to pursue any of these or wanted to pursue any of these, what were the steps needed to be taken. So I think I will turn it over to Dan to give us a update on what he's had for conversations and discovered.
Thanks, Karen. Yeah, I did in fact, over the past couple of weeks, do a unofficial survey, but I contacted the boards of health representatives in 3 cases, the chairs and at least all of the administrative assistants, to gauge, what their opinions were of the emergency order for a mask mandate. And as you probably know, West Boylston was like first on board, and then Shrewsbury followed. Worcester was right in there too, obviously. And frankly, they expressed some pretty significant pushback or negative feedback from townspeople and or businesses. They're still hoping, to keep it going, but they did mention that enforcement was a pretty big challenge, especially with the businesses. I also contacted Millbury, Sutton, Upton, and Northbridge representatives of the boards of health. They had considered it, doing the mask mandates. However, they decided at this time not to pursue it, to keep it on the stove, but on the back burner, and keep an eye on the trends, because the trends have apparently, from what I've seen, trended down, but also at least leveled off. And I touched base with Evan, our town administrator, as well about the three separate mandates that were adopted by or promoted by Worcester, West Boylston, and Shrewsbury. I think all 6 of them actually admitted that Worcester is somewhat of a different animal, so to speak, between population, but also the college population, senior housing, congregate housing, that it's a bit more of a challenge overall. And so I don't know what anyone else thinks about that information, but
This is Austin Magnet. Thank you, Dan, for doing a lot of that research and a lot of that communication. That sounds like a lot of towns you reached out to, so thank you.
sure.
And, I was kind of thinking along those same lines where enforcement sounds like it might be something that would be one of our hardest, biggest things to tackle if we were to put a mask mandate in. I don't know if anybody else has any thoughts on that, but
This is Bill Muller. I would agree. I mean, I think my sense is that we could make a more affirmative statement about the value of masking, and that we're strongly encouraging people to mask. My concern, though, is if you make it a mandatory requirement without any enforcement, you're putting the businesses and other public areas in the crosshairs. I'm not surprised that they've had significant pushback in Shrewsbury. Obviously, the lead story on the national news tonight is that COVID cases are going down, hospitalizations are down, and daily deaths are down. So I think it would be hard to make a compelling argument that you had to make it absolutely mandatory. By the same token, I think it's clearly beneficial to mask, and you could make the argument that the staff is put in harm's way by trying to service people who are not masked. Although in my experience, I think a lot of the stores around here, some of the staff are masked and some of them are not. So, I mean, my suggestion would be to be a little more out front with the fact that we think it's a good idea, and that we not quite go to the point where it's mandatory. We had this discussion, of course, now some places for people who are not vaccinated are actually, discharging people and so forth. But I think a lot of the emphasis really should be on trying to get everyone to get vaccinated.
I would agree with everything that's already been said. I think the only thing I would say is that if the data should shift in another direction, I think that we should be kind of, now that we have some of this information, probably ready to make a decision quickly if we were to change something. But I just don't know that we could justify where the data is trending in the right direction at this point.
Exactly.
Dan?
Yes, certainly if there's a spike before the holidays, I think we could convene pretty quickly. The other piece of it, I was trying to get in touch with UMass to see what their capacity is of ICU beds. I know a month ago it was very tight, and I was actually reaching out to my neighbor and friend, Dr. Steve Tosi, who's the chief physician executive at UMass Memorial, and he hasn't gotten back to me yet. But Dr. Muller, you had mentioned that you're familiar with Milford Regional.
Yeah.
And they're not necessarily at capacity.
Right. I think certainly Milford did go through its peak in the spring and early summer and so forth. And it was very, very demanding at that point in terms of number of patients in the ICU and on ventilators. They have not, at least to date, experienced that same sort of surge. They're averaging more like 5 people in the hospital at a time this period, but they were back in the 30s and more in the spring. I think UMass in general, though, I think has been overwhelmed, not just with COVID patients, but just with patients in general. I think part of the impact has been the closure of the St. Vincent's Hospital beds due to the ongoing labor action that's kind of dragging on there. They took 100 beds out of service, and obviously that has a direct impact on UMass. So I'm hearing that in fact, clearly there's long wait times in the ER. There's slowdown of all kinds of other care. It's not just COVID related. I think it's just overall demand related. Certainly COVID contributes to it though, absolutely. And I'm sure that part of the genesis of the recommendation to mandate mask wearing in Worcester was probably generated because of concern of what impact it was having at the university, both at the university and Memorial campuses, for sure.
So I guess what I'm hearing, I guess, is that the consensus is that we should continue to strongly encourage mask wearing, and as well as encouraging more vaccinations. And now the children are going to be coming along, and that's going to be pretty interesting and quite a challenge to get them going, as well as the boosters, Moderna and J&J boosters. So there's still a lot going on in the healthcare industry. And I guess, Karen, you're going to talk a little bit later about the whole Halloween thing too, but just maintaining the level of open air and social distancing and hand sanitizing. I think I've seen that kind of go a little bit by the wayside. So I think we might want to try to get something out about trying to stay vigilant in that regard too. And then look at it in 2 weeks at our next meeting. I think is on the 8th of November. Is that 2 weeks? Pretty much. And just see where the numbers are at that time.
Was there further discussion of schools in town other than the public schools, like Touchstone or?
Yeah, I did happen to get through to an administrator at Touchstone, and they are in fact, they have pretty strict protocol in terms of masking and distancing and sanitizing. So that was good to hear.
Yeah, and even my 3-year-old granddaughter is masking at her daycare for sure.
Yeah, I think some of the kids don't really mind it. It's kind of
Actually, it's the norm for them,
yeah, right.
It's kind of.
Is there anything else on the COVID mitigation efforts or any of the 3 potential mandates, at least at this time? And obviously we can keep them, and revisit them again. Our next meeting's in 2 weeks, November 8th, so.
Right, that's what I would suggest.
Karen, should we make any effort though, like through the newspaper or anything of that sort, to kind of reiterate that we still think it's a very important thing for people to consider?
Yeah, I mean, I'll look with Nancy when the last time we put something out reminding people again to mask and social distance, et cetera. I just don't know off the top of my head when the last time we pushed out a strong reminder again was. It's probably been a bit. Right.
I mean, the sign when you go into Stop and Shop says they strongly encourage it. So I think we're, consistent with what they've already posted.
I think we talked about this when Dr. Mueller and I joined the meeting last week for the emergency response, but do we have any social media presence for the Board of Health? Just where we could push some of that out as well?
Yeah, usually anytime Nancy posts something on the Board of Health website, it can also, as long as we request it to be, obviously, goes out through the Town of Grafton's Facebook page and stuff. There's no separate Facebook page for like Board of Health, et cetera.
That probably wouldn't be bad just to, have it out. Certain people seen it too often as of late because we haven't been necessarily pushing it out there, but maybe we could put that out too.
Yeah, and I know when the weekly reports go out with the cases and the vaccination counts and all of that, there's always, but it's more at the bottom where it says like the links to the masking and the vaccinations and all of that. So maybe I'll see if Nancy can shift that and maybe put that info at the top and then say, here are your cases and vaccination counts for this next one.
Yeah.
Because we can tweak. I mean, that's a template that was created in Word that she plug and play. So she has the power to shift it around and we can tweak it to put it, because probably have a lot of people that just don't get to the bottom. They see the numbers and go, okay.
Yeah. Well,
Like,
you get desensitized when it looks the same each time too. So you don't kind of look for anything new in it.
yeah, it's not like this flashing red lights at the bottom
Yeah.
saying like new masking info or anything like that at this point.
Right.
All right. And speaking just before we leave this topic, it is technically a mitigation effort. It's not one of the 3 potential mandates, but just I did want to mention, rather than waiting until the November 8th meeting, just the update that I'm sure all the Board of Health members have already seen and heard about was just quickly around the boosters now for Moderna and J&J. And I know Nancy's going to, if she already didn't, put something out with more information, a lot more information, on those boosters, not just the Pfizer ones at this point. So to get those out to the public. And I know that the pharmacies already, as of late last week, like the day after the CDC gave their blessing, I know CVS and Walgreens and others were already updated their websites so people could start getting booster appointments besides just Pfizer people or immunocompromised for their 3rd dose.
One thing that I discovered was that some of the sites offer Pfizer and some of them offer Moderna. So I think people are going to most likely choose to go to one which is offering the same vaccination serum that in fact they got initially. Although it's now permissible to mix and match.
Yeah, and I know CVS's site at least is very upfront when you get to North Grafton, Moderna,
It's
Moderna.
Moderna.
Whitensville, Pfizer. So early on, I remember when people were like trying to hunt for their original vaccine appointments, and you had some people like, I want Moderna, or I want Pfizer, or I want J&J. Some of the sites, the Walgreens, the CVS's, et cetera, of the world didn't right up front tell you when you were selecting a site which they were offering until you got further down, and then you got to that like, here's your sheet to look at and review, and then you could, oh, it's Pfizer. So they've obviously fixed that along the way as everyone's been working through this. So they've definitely made it easier when it comes now for whether it be someone's 2nd shot or 1st shot or boosters, that it's much easier to figure out where you want to go. It's also much easier to get an appointment nowadays than it was at the beginning. All right, if there's nothing else on that, then we jump over to Halloween recommendations for this year. So I dug out last year's Halloween recommendations because we haven't had to worry about them since last year, which were based on CDC and state guidelines. And this year, obviously we can discuss it. My thought would be we're still within Triple E and West Nile potential because we haven't had a first hard frost. So I think similar as last year, any recommendations would be make sure we put the reminder out as part of it like we did last year. Triple E, West Nile, 5Ds, all of that, because looking at the forecast, it doesn't look like we're going to get a hard frost before Halloween at this point. And then in terms of COVID, unlike last year where the state had put out kind of, we'll call them recommendations, not rules, the CDC, they had much more, not stringent's not the right word, defined, I guess, recommendations. My review over the weekend looking for what experts were saying, it looks like CDC, et cetera, is saying try to make it still as contactless as possible. So think like pre-package up some bags of candy so a child can just go and take a bag off a table versus sticking their hand in and digging through all the different pieces of candy. Obviously hand sanitizer. They talked about like if you're indoors, wear a mask, and especially if you're talking Halloween, you're probably talking a Halloween party, not just a family by itself indoors. And then trying to focus on smaller groups, even if you're outdoors, not some big celebration. Last year, there were actual gathering restrictions and limits still in place. This year, as we all know, there aren't. So that's what I found. Colleen, I don't know if you've seen anything different.
No, we haven't. We actually just talked about it today at an internal meeting, and we have not seen anything different either. Basically, what you said, the CDC is encouraging to try to maintain social distancing, to, wear masks. But certainly, we haven't found anything that's in any way suggesting that towns should be, for instance, canceling Halloween, right? We haven't seen anything, just more of, be smart about it, right? Be safe about it and be smart about it. But that's all we've seen from the CDC as well.
Any questions, board members? Dan?
Yeah, so I don't know if there's time to put a recommendation to that effect into the Grafton News or not. They think their deadline might have been today for this week. But I guess we could at least get it up on the website, the town website. Anyone that wants to take it from there would be fine.
Anyone else have any questions, comments? All right. All right, then the final topic is flu clinics / EDS. On the flu clinic side, Walgreens did get back to Karen Clark, Nancy, and myself with some questions around, were we thinking just town employees, potentially how many? Then they got into insurance questions, like what insurance town employees have, et cetera. So Nancy had answered back. Walgreens contact was going to look to see if they could find a site around that could do it, and that's where we stand at this point from at least a town employee perspective. That's as much info as I currently have based on last week's communications. Obviously, as we all know, flu vaccine is widely available in CVS, Walgreens, and other pharmacy locations, et cetera. Just for anyone who is looking for one that doesn't want to wait for a potential clinic. On the EDS side, Dan, if you want to take.
Yeah, actually, if we could just jump back for a second to the flu thing. I don't think there are that many seniors that are employees of the town, but the Medicare card covers flu vaccines, the red, white, and blue card. The other thing is I happen to be speaking with Cheryl Rowinski from Sutton. She's running a flu clinic in Sutton at the elementary school, and she was going to get back to me with the date and the day. But she said anybody from Grafton would be welcome. She's had another one or two already, and frankly, the numbers of people coming are not like they had been in previous years for whatever reason, but I think part of it's because it's been available at pharmacies. But just in case anybody doesn't want to go to a pharmacy that she said just to contact her or the town of Sutton. They could help out in the meantime if someone was anxious to get it and couldn't wait for the Walgreens setup or any other. So then if I can jump into the EDS, I was in touch with Jamie Terry, who's the Department of Public Health Regional 2 emergency trainer, and a lot of you have met her. And she mentioned that this year it's not a requirement to have a live EDS drill. Forrest, I think his last name is Price, is actually the FEP director, which is the Public Health Emergency Planning, I believe. So he sent out what our current plans are to Nancy and to us. And he said all we need to do is review it and revise it if there's different contact people, which in fact there are. And so I'll take that on with Nancy and try to get the current town administrator, a couple new Board of Health people, and their contact information for, an emergency number. There's like 3 lists, to initiate a drill in real life. They need that information. So I'll look at the whole thing. It's about 120 pages, but I think 3 or 4 of the lists need updating, so I'll be able to do that. So frankly, I think that's kind of good news that we don't have to round up 15 people on a Saturday morning between now and when the snow flies.
Any questions from anyone on the EDS side of things? All right, seeing none. So that was our last topic. Especially given this was kind of an extra meeting as such. So just to reiterate, there was no email correspondence or anything like that in terms of upcoming meetings. We have November 8th, as we discussed, December 6th, December 27th, and then in 2022, we scheduled January 10th, February 7th, and March 7th as of this point. That's all we had. Damn.
I'd just like to say, I hope everyone has a happy and safe Halloween. And I'd like to make a motion to adjourn this meeting.
This is Austin Magnan. I will second that motion to adjourn the meeting, and happy Halloween, everybody.
All right, all in favor?
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Ben Maynard, aye.
Karen Gwiazdowski-Govan, aye.